I'm Axel Hombach from Cologne in Germany. I'm a hypnotist. I work as a hypnocoach and trainer in hypnosis, teaching people basic and advanced techniques in hypnosis. I'm right now online with Dr. John Butler of the HTI in London. The HTI, that's the Hypnotherapy Training International, of which he is the director. He is, so to speak, the successor of Gil Boyne, one of the most influential hypnotists of the last century. John Butler was one of the teachers I had, and I consider him the greatest teacher I ever had in many disciplines. A few months ago, I had the pleasure to have him here with me in Cologne giving a workshop on transforming therapy. This workshop was so well received, the feedback was so fantastic that we decided that we are going to repeat the course, and we will also offer more classes, more workshops in hypnosis, broadening the application of transforming therapy. So before I start and talk more about that, please, John, say a few words about you, who you are, what you do, and where people can find you.
Hello, Axel, and delighted to speak to you in this informal way about my work in hypnotherapy and about the approach that we call transforming therapy. Which is a broad and deep approach to the practice of hypnotherapy. I've been working with clinical hypnotherapy for over 35 years. Prior to that, I certainly used it, but I would not say I was in full professional practice. Since about 1990, I have been teaching hypnotherapy in many countries around the world, and we've had here in London a great many people pass through our classes, some who have gone on then to become established teachers in their own right. We've also trained many therapists who are out there practicing this form of hypnotherapy, this deep and very broad approach as I've described it, with wonderful benefits for the people with whom they work.
Thank you, John. We have been talking on Skype and on phone during the last weeks and months since the last workshop, and we talked about many topics that we could probably teach, that could probably be of interest for people, and that was also including topics that you have already given workshops in, especially as an adjunct or from the perspective of transforming therapy. I have a list here of possible topics that we talked about, like stress management, performance coaching, assertiveness training, public speaking, relationship, but also what we could consider classics in the field of hypnosis, smoking cessation, and weight management. We talked about that, what could be of interest, and we decided we would make a pre-selection of choices of fields that you have taught in connection with transforming therapy out of your many years of experience, and we give the people who would like to participate the choice. We make a survey, and they can choose then, let's say, 2 or 3 courses that next year we will give in addition to the Transforming Therapy Masterclass. So we had definitely weight loss, which is from the perspective of transforming therapy a little bit different than other approaches. Also smoking cessation, which is also different from the perspective of transforming therapy. And do you have in mind 2 other courses that could be of interest for people?
Yes, Axel. Well, this is a very important development, over the years we have found that many therapists are interested in taking their skills further. We had such wonderfully positive feedback in Germany to the classes there that we have decided that we would offer a range of courses. Now these courses are intensive specialized trainings in subjects like typically the weight management, smoking cessation, performance enhancement, childbirth, relationships, and there's quite a few other courses we run which are under the label of transforming. So we have transforming quit for smoking, transforming weight management, etc. The goal of those classes is to help the practitioners take their abilities to another level, because we find that people have trained in these topics, in these subjects initially in their courses, and some training courses of course are a lot more in-depth than others. Now when they're in practice, often they find they would like to do better, particularly in the early stages, in building their confidence, in feeling that they're up to the job, in dealing with difficult clients sometimes. They really need all the help they can get. So these classes have an awful lot to offer both beginning therapists in the early stages of the career, and also the advanced therapists. They learn many things as well. They learn to confirm their existing knowledge and skills, which helps to increase confidence, and it's very valuable to have further confirmation and validation and reinforcement of what you already know. And then of course there is additional knowledge they may not have come across before, further principles, skills they learn. And so even for the advanced practitioner, there's often a great value in these courses. And specifically, and most importantly, for somebody in the earlier stages of their career, they gain a great deal from these classes. So they are intense and specialized. They assume you know a certain amount about these topics to begin with. However, these courses are also are to a certain extent masterclasses, because I'm bringing a lot of knowledge and experience of my own into them. I'm bringing over 35 years of a great deal of clinical experience, working with clients day in, day out. I'm also bringing a lot of knowledge from my background in medicine, medical science, medical teaching, and in psychology, psychotherapy, which I've trained in academically and qualified in postgraduate trainings in psychotherapy. And I bring experience from a wide range of training courses in hypnotherapy that I've been on over the years. I've had the good fortune to be with some of the very best of medical hypnotherapists and learn from them. So all the knowledge and experience that I can bring to the topic, I bring to those classes. Now, transforming therapy is both very deep and very broad, as I've mentioned. It goes deep into the roots of the issues that people are bringing to the therapist.
Okay, I understand that. The great difference now between the, let's say, more traditional approaches and the transforming therapy approach is that you go to the deeper rooting levels of the issue, and you uncover first what the beliefs are, the self-image is, what's beneath the origin or the reason for smoking, and then you work from that. And I understand that you have, with your almost 40 years of experience and your background in various disciplines like medicine and psychotherapy, in addition to transforming therapy, hypnosis, you have such a vast body of knowledge and experience that you pack into this 1 or maybe even 2-day course with which you then teach people to leave the classic way and go more to a transforming way and help the client to achieve its goal even faster than it would be possible with any other method that is usually used in hypnosis. Is that correct?
Yes, that's a good summary.
Again, sounds very interesting. There are probably not many hypnosis trainers here, at least not here in Germany, who have these almost 40 years of experience to back up what they teach. And before we come to a close with this introduction, is there anything that you would like to add?
Firstly, Axel, I'd like to say that I'm really enthusiastic about passing on the knowledge that I've acquired, the technical and detailed specific knowledge that goes into each of these courses, and the skills based on sound principles of trance development, trance management, many different levels of trance, the principles and skills of profound hypnotherapy. That's what I want to pass on in these classes, and I certainly look forward to talking to people who are already in practice and giving them my knowledge and experience and all the help I can. We deal with a lot of questions at these classes and follow-ups as well, that we can help them as they practice. But we have the benefit, of course, of a great deal of experience now of having trained practitioners who are using transforming therapy, which is the main modern version of deep hypnotherapy out there. It's from which many offshoots, such as parts therapy and so forth, have developed. Gil Boyne's seminal work in the 1960s, which took the work of great practitioners like Dave Ellman and his advanced practice of hypnoanalysis, Gil took that much further, because many developments have occurred in the last 50 years. Old-fashioned hypnotherapy would often include a lot of very rather simple authoritarian suggestions from a doctor, for example, without understanding more of the subtleties and complexities of the subconscious. So we've acquired a great deal of knowledge now that's moved us away from some of the older approaches, and this needs to continue. That the field, like everything in this world, it needs continuous evolution, and so we keep on adding to the courses in terms of knowledge and better and better ways to transmit the skills, and the skills themselves keep developing. So I hope that I will be passing those on in the very best way I can. That's my goal.
Yeah, I think you have accomplished that already. I just remember one of the feedbacks of the last workshop was the way John Butler teaches makes learning fun. So we had a lot of experienced hypnotists in the class, and I was a bit I didn't know what to expect, what kind of feedback we were to expect, and well, everybody can read the feedback on the homepage of NOJ Hypnosis Ausbildung, and experienced hypnotists have all found that you are one of the greatest teachers there is out there currently, and I think we should benefit from that as much as possible, as long as you're there. Well,
Thank you very much for that, Axel, and I'm delighted to hear that they found it, I probably use the word enjoyable, fun in that sense, and I'm delighted to continue with doing this, teaching and transmission the knowledge out there in the world.
Yeah, so what we are now going to do is that we are putting this variety of courses that we talked about to the people. We offer the courses, and the people then can choose what they want to take. We are going to offer these courses that we just introduced in 1- and 2-day classes, and all the courses, weight management, Transforming Quit, Relationship, Stress, Childbirth, all those courses. We will then see how much interest is distributed over the courses, and then we will take the 2 or 3 most popular courses we will choose and then offer them in that form that people want, as a 2-day course or a 1-day course. And of course we will offer, if participants want to participate in all courses and take the maximum benefit out of it, we will offer of course reduced prices, packaged prices, so to speak. And until then, I hope you will participate in this survey, and if you choose all 4, if all 4 courses are of course equally popular, I mean all 5 courses, we will think about a solution there too. Until then, John and I are going to prepare a series of highly interesting interviews on various topics, like analytical hypnosis, like the history of hypnosis, like transforming therapy, like where a little bit more about John then is currently known, and a bit more about Gil Boyne, and highly interesting interviews, talks, and I hope you will all look forward to them, and participate in our survey. Check out our websites in Facebook and other places, Transforming Therapy. If you look for it, you will find it. Before I say goodbye, maybe John, some last words for today from you.
Well, thank you, Axel. I would just reiterate in finishing that we're interested in providing the very most useful information, the most valuable courses for you. So selecting the topics you are most interested in is a starting point, and then we will arrange that to deliver those next year. Also, as Axel said, there are a lot of topics within hypnotherapy that don't get discussed enough. Occasionally at conferences there may be a mention of them, but even there, topics such as the history of hypnotherapy, which is often poorly covered. Admittedly, it's not something that should dominate a huge amount of the classroom teaching. Students can read up on it, but nevertheless, when they read about it, depends on the kind of books they read. They may have a very incomplete knowledge of it. You would have to read many different kinds of books to get a good understanding of it. So I'll be very happy to speak on a range of interview topics in this kind of informal way with Axel. And if you have suggestions and areas you'd like to know more about, please let us know of those.
Thank you, John. It was a great pleasure to talk to you, learn more in depth about the courses that we are planning, and I'm looking forward to doing with you the next interviews, the next talks, and prepare the workshops next year. So to all of our listeners, have a safe day, good time, and see you soon again.
Thank you very much. Goodbye for now.
Goodbye for now.